All right, let's dive right into one of the most demanding fields out there, dentistry. There's a question that is totally shaking its foundation. How in the world do you test the next generation of dentists when an AI can ace just about any question you throw at it? We're going to explore how artificial intelligence is forcing a complete reinvention of the exam room.
We've all been there, right? The take-home essay. It's been a cornerstone of higher education forever, a way to see if you can really think deeply about a topic. But with these new, incredibly powerful AI tools, you have to ask a pretty serious question. Is this it? Is this the end of the essay as we know it?
And look, this isn't just speculation. Experts in medical education are basically sounding the alarm. This quote from a major guide puts it, well, pretty bluntly. The standard essay is becoming irrelevant. And that forces us to get real and ask, how do you tell what a student actually knows versus what an AI just spit out for them?
Okay, so before we jump to solutions, let's back up a second. We need to ask a really fundamental question. What are we actually trying to test in a field like dentistry? This is about way more than a letter grade. The stakes here are incredibly high. We're talking about a patient's health and safety. To get what's happening, it helps to think like an educator. You've got assessment for learning, which is kind of like a coach giving you pointers during practice. It's all about improving. Then you've got assessment of learning. That's the championship game, the final exam that says, yep, you're ready. And believe me, AI is shaking up both. And really, both of those feed into this bigger idea, competency-based assessment. This isn't about what you can memorize from a textbook. It's about what you can do. Can a future dentist perform a tricky procedure? Can they make a good call under pressure? It's all about proving you have the skills for the real world. All right, let's bring in the main character of our story, artificial intelligence. It's already here. Students have it on their phones, on their laptops. It's like a new super-powered study buddy. But the thing is, there's a huge gap between having the tool and knowing how to use it like a pro.
Check this out. A recent study found something pretty wild. Over 80% of dental students say they're familiar with AI. Makes sense, but less than 40%, actually know how it's used in their own field. That is a massive knowledge gap that educators have to figure out how to close.
So what can this tech really do in a clinic? Because we are way, way past just writing essays here. Let's look at a super practical example, reading a dental x-ray. It's one of the most basic, fundamental skills every single dentist needs to master. So researchers did this really cool study. They basically said, okay, ChatGPT-4, you're the dentist now. They gave it these panoramic x-rays and tested its ability to spot infections. Sometimes they gave it a little hint, sometimes they didn't, just to see what would happen. The question was simple. Can you find the problem? And the results? Honestly, they're kind of mind-blowing. On its own, with no guidance, the AI completely failed. Couldn't do it. But when they just gave it a little nudge, just drew some circles on the areas to look at, boom. Its accuracy was suddenly right up there with professional, experienced dentists. This is the whole story right here. AI isn't a replacement, it's a ridiculously powerful tool that needs a human partner to work. So, what does this mean for school? Well, it changes everything. The whole conversation has to flip. It's no longer, how do we stop students from cheating with AI? It's now, how do we teach them to use this thing like a professional, ethically and effectively? I love this analogy because it's just so perfect. Remember when calculators first showed up in math class, a lot of teachers banned them, right? They were worried kids would forget how to do basic math. Now, we just assume you have one, and we test you on much harder, more complex problems. That's exactly where we are with AI. So, okay, back to that essay problem. How do you actually grade one if you know an AI helped to write it? Simple. You don't grade the final text, you grade the process. You look at how well the student prompted the AI, how they fact-checked its claims, and, most importantly, how they analyzed its output. The grade isn't for the essay, it's for the thinking behind it. This opens up a whole new world of what educators call authentic assessments. I mean, instead of a boring multiple-choice test, imagine this. A student has to diagnose a virtual patient powered by AI, a patient who reacts to their decisions in real time. Or they're given an AI's treatment plan and graded on how well they can critique it. This stuff is cool, and it's what actually prepares them for the job. So what's the end goal of all this? It's a whole new vision for what a healthcare professional is. We're not trying to train dentists who can be replaced by AI.
We're trying dentists who can partner with it, who can use these amazing tools to give better, faster, and more accurate care to their patients.
Now, this all sounds great, right? But there's a huge but we have to talk about. As we start using these tools in clinics and classrooms, we have to navigate some really complex ethical questions. It's not enough for it to work. It has to be used safely and fairly. A big review from 2023 really laid out the biggest worries. Bias in the AI's programming was the #1 concern, mentioned in a whopping 74% of the research. Right behind that was patient privacy. Making sure these systems are fair, transparent, and that someone is accountable when things go wrong, it's not just a nice idea, it's absolutely essential. So, how do we deal with this? Well, you build guardrails. This means training professors so they know what they're doing. It means creating crystal clear rules for everyone. It means locking down data to protect privacy. And that last one is the most important part. You have to keep a human in the loop for all the big, high-stakes decisions. Period.
You know, when you boil it all down, this whole revolution isn't just about technology. It's about redefining what it means to be a competent, critical thinking professional today. The real challenge for the next generation of dentists isn't having all the answers memorized. It's knowing how to ask the right questions of their patients, of their colleagues, and of their powerful new AI partners.